I know it's around 6 p.m. So actually, while listening to the panelists, I actually captured some keywords because we are talking about the big overarching principle of data governance or health governance. But for example, what you mentioned at the start, which is it should be an integrated one. And even when Dr. Rice were mentioning about the cost effectiveness. So how can we actually capture the cost effectiveness of the sectors if we don't have solid and robust data? And then even followed by Dr. Hunter when he mentioned the adaptation of global models and so on. So if we would like to track our path, we need to start first to understand that if you cannot measure our success or our pathway, it will be actually difficult to track it, to manage it as well. Here goes to as well Dr. Hanadi for the process refinement. Again, we need data to make sure that we do have a strong process that we can actually refine all the way. And ending by Fernando mentioning that we need to optimize resource allocation. And again, we are returning back to the data. So I would like to start that. I know that sometimes it's health data governance, or in Arabic, حوكمة البيانات الصحية, is not that, it's not with a good sex appeal to be familiarized with. However, the overarching principle of governance, we need to be sure that we do have as well beneath it a good and robust health data governance. And just to give an overview what we are doing, because we do have wealth of data in Egypt, and it's actually the new oil resource for us. It's a treasure. But how can we make sure that the data is actually available? That's for first. We do have multi-sectorial. We do have a lot of sectors in healthcare, and we need to make sure that the data is there. And this is the first pillar. And then that we are actually using it. Usability of data is the second principle of the health data governance. And then we need to make sure that the data integrity is there. And finally, the security. While mentioning the terms, you can actually relate that we do have it, but fragmented a little bit. We do have multi-sectors, and each sector is actually playing at that. We've seen the strategy this morning, and one of the main pillars was actually informed decision making. So if we would like to take a national informed decision making, we need to make sure that we do have a robust, I'm not going to be talking data management, but a robust framework for governance of the data itself. So I'll not be tackling the data management itself. This is data science, but how to make a governance framework. Same for economic growth. We do have a very ambitious vision for 2030, and if we would like to have more investment in the private sector, we need to actually tell the investors we do have a good framework. You rely on our data. Come and invest in healthcare providing, for example. Same for data privacy. Same for data security. And finally, the person centricity mentioned by the minister, which is actually above the patient centricity to make sure that we do have a preventive measure. We need to have, for example, a good epidemiology map. How can we acquire this if we don't have a good health data governance? Hence, a project started, and we have a dialogue and a communication with the Minister of Health for the previous 12 months in order to make sure that the scattered data signals and points that are already in place are used efficiently. Of course, we do have a lot of roadblocks. Human resources, for example. How can you actually convince people that it's very important that to make the data entry in an optimized way, especially that we do have few numbers of doctors per 10,000, we do have like one physician per 1,000 citizens. So we need to make sure that we have enough registrars for that. We do have culture issue for data governance. So governance should be cascaded to be a behavior. That's what we are actually trying to do with the healthcare professionals. And then we do have a legal challenge. We do have a lot of legislations, but we don't have one integrated single framework to actually put all the sectors in one actual circle. And finally, and the most important, the cross-sector collaboration. As Dr. Hanadi as well mentioned, we do have a lot of sectors, a lot of ministries. We can count 11 ministries and actually entities working in the same field of governance that they need actually to integrate. That's a big challenge, and that's what we're actually trying to do. So my final thing about this project is we started with the concept notes to understand it, and we highlighted how can we actually put our fingers on the problems in the data centers, and that developed to a positioning statement that if we can implement fully the framework first, it shouldn't be actually a one-year plan. It shouldn't be a leap. We need to make it slow and steady. Baby steps, a 5-year plan, it will be fine to implement a good health data governance on the ground. Not of writing, of course. Writing will be easy. You can write the health data governance framework in a 6 month or so, but to implement it actually in Egypt. I hope that next year, inshallah, or my next question will be talking about the roadmap, we'll be celebrating something like that.
Shukran. Thank you very much, Dr. Islam, for providing this brief about what's very needed and the cost effectiveness cannot be achieved without proper data, etc., etc. Going through this experiment, we understand you have a current ongoing project with the Ministry of Health. And being listed, all these